those who are born vaginally will have problems with torsional experiences. They come into the world by a natural series of events, and in order for them to make their way through the canal, Still talked about what is normal. He said in his lectures always, you must know normal. If you know what normal is, you can therefore be prepared to handle any of the abnormal. So today, I'm going to teach you something that I never learned as a student, and that is what is a normal delivery, what is a child going through in delivery, and then how can you unwind or heal the traumas associated with that. Now, for those of you who were in my lecture this morning, or our discussion, I was really pleased. I was honored to have our team with us from Eastern Regional Medical Center, so we were able to talk about the mind-body medicine relationship. We were talking about patient experiences. And one of the things I want to be culturally attuned to here is that I spoke this morning from my experience. Now, I have wandered the earth. My degree's in history and literature. I spent 4 years hitchhiking through 48 countries. I can speak a variety of languages, and it is very important to me that I'm an inclusive man, that people should feel comfortable in my presence. I want to be a source of love in the world, not a source of anything beyond that. So if I said anything to offend anybody this morning, I do apologize. My message is simply love and the ways in which to bring people together. So I want to make certain that the other thing is I can say salam alaikum, I can say namaste, I can say peace be with you and also with you. You know, however you guys want to do this, the bottom line is I'm here to share what I've learned in life. So if any time you have questions or concerns, I want to be an open book. The course I'm going to share with you, this part of the course here is about philosophy. And I try to walk in the shoes of Andrew Taylor Still, the son of a Methodist minister who was on the frontier learning about life sciences from the Shawnee. Here was a guy who had lost 3 of his sons in the hands of his colleagues. He was an MD. And then losing his 3 children, he said, God, are you really there? And if you're there, are you nothing but a murderer? Or do you love us? Having come to that realization that he is a loving God, he could then see what he had to do to heal it. And he read back in Scripture, his dad had shown him, that Genesis, according to Christian Scripture, says that you were created in his likeness. And so he said, if that's the grand architect's idea, and I'm created in his likeness, then I must know his likeness implicitly well. And so he strove to learn anatomy. So I want to just preface all of that. This is the bias I have in the presentation, but I am a loving man. I'm trying to include everybody in the conversation. So here's our hero, Andrew Taylor Still. This morning I had a femur in my hand, and I was saying, okay, so who am I? I'm like, you're Dr. Still. No, I'm Chris Stevenson. That's Dr. Still. So, do we have this video keyed up here? I did not know this existed. Oh. Got it. He's got it. Beautiful. So this is a video available on YouTube of Dr. Still. And he's here reducing a shoulder dislocation and putting together a first rib, putting these back together again. For me, it was really so cool because, like, wait a minute, this guy's really a man. He really existed. And you are different because of a man's suffering. Because of his immense loss and his sorrow, he sought there was something else better. He looked at nature, he looked at God's design, and he said, there must be a reason for all of this. So, I wanted to show you that just as you got identified, this was a man. He was a loving father. He was a guy who wore his clothes thin. He really was not a man of pretense. If you get a chance to read Dr. Lewis's account of him, it's a wonderful biography of Dr. Still, one of the most powerful ones I've ever read. But I want you to kind of identify, here was a man. And you are all different because you guys chose a different path to be osteopaths. I'm trying to get it now to... There, okay. So as I said before, so God created mankind in his own image. In the image of God, he created them, man and woman, or man and female, he created them. So the tensegrity structures. Have you ever seen a tensegrity structure before? Yeah, tensegrity is really fascinating. It's the reciprocal tension membranes that are continually under tension during both inhalation and exhalation. They are like a tension wire pulling and obstructing, so if you distress one, you will distract the other in an opposite direction. the cranial mechanism is much like that, and that was kind of what Sutherland had seen. That was what he saw and observed, that if you distort one thing one way, it'll affect the other side as well. Embryology, it's really fascinating. I've seen how diaphragms form in the foot and in your abdomen at the same time. And as an osteopath, I can treat a foot and treat a diaphragm, a pancreas, a kidney at the same time. It's been funny how I'll get them both to release spontaneously. So I look at this embryologic thing because things are occurring about the body's mechanism through a series of times. And as signals are sent, it affects the entire mechanism. It is really cool. You know, you get right down to it here, and at the 7th week, you really have a fundamental little baby inside that's all ready to rock and roll and continue to evolve and grow. It's a miracle. I was talking about this morning that when your mother was born, she had you inside of her. You, who were to be the egg of that future person, was within inside your mom, protected all of those years. Meanwhile, your dad and his ways, there were millions of opportunities, and there were many millions before and after you were created, that his fascia joined your mother's fascia to create who you are. Remarkable mystery of life that I still am amazed by. So we're going to get to this thing here. Do you see how the baby is faced in the pelvis? Who can tell me what direction you see the baby here? I'll give you a hint. The pubic bone's in front. Facing the right. Okay, so the face is facing to mommy's right hip. The chest is facing mommy's right hip. The pelvis is facing mommy's right hip. Everything is aligned. This is the natural way a baby comes into the world. Engaging. This is the first part of engagement. The next part, the birth stages here. So the baby is engaged, then descends. What's not really shown here well is the baby does not turn in the canal. The baby has to find normal. And this is what, if you guys get one point of all of this lecture, it is this. You have to come into the world being as streamlined as possible. And you have to be tucked in as narrow as you can to be able to fit through a very narrow passage. So the head is turned hard to the left, causing immense loading on the perivertebral ligaments of the 3rd, 4th, 5th, and 6th vertebra on of the cervical spine. So here is the right side. Here you have the occiput, you have the atlas, the axis, and C3. C3, 90+% of all your rotation, of course this one doesn't want to turn for me, 90+% comes out of the axis of rotation of the atlas on top of the axis. So as your head is turned hard 90 degrees, do you see how that loads up on there? You see how that torqued over? So in order for you to turn your head hard to the left to look at your shoulder, these vertebrae, C1, 2, anchor hard into 3, 4, 5, and 6. So those of you who are born vaginally, if you think about where your headaches come from, you reach back behind your head. Right here is where 90+% of your headaches are arising from. So the tension headaches while you're bent over studying too long or whatever, that's C3 on the right. So far so good, everybody? Okay. So again, knowing what normal is. That was never taught to me. The fundamental, like, so why does it hurt on the right all the time? Well, that's why it hurts on the right all the time. So we're going to, next video here, if we can, Jonas. Oh, there's an updated version of that. Okay, so basically you see how the baby's facing the mommy's right hip. The chest is facing the right hip. There may be a little bit, the head has to turn all the way, and they act as if the whole body turns, and it doesn't. The whole body is made to be, so that is not the normal birth, but that's the closest depiction I could find. And so you deliver the head, then you deliver the shoulder, and bam. Has anybody been witness to a birth? Okay. So, you know, the baby comes out, and it's, the healthy baby has their occiput coming onto mommy's pubic bones. Baby's looking at mommy's tailbone, comes, out breaches through and then turns the head, spontaneously look back at mommy's right hip again, because the shoulder has to follow. And so the shoulder comes and then flies on out. So we can, thank you, Jonas. But that's what normal is. So when you can see what normal is, then you can understand why physiologically do people always have headaches. Why do people have headaches on the right side of their head? So Still talked, I love this guy. He was a philosopher and a deep thinker, and he had to think the why. He was an existential why kind of a guy. So what causes dis-ease? Irritation of the sensory nerves, he postulated. You had congestion that arises. So when congestion occurs, like spring, rain comes in, fresh water fills the basin, and it's beautiful, flowing, clear. But by August, if there's no more fresh water coming in, what happens with the water? Yeah, it stagnates, it turns green and mossy and all that. And that's congestion. And you have inflammation setting up in there because nature deplores a puddle. You have recovery or you have death. It was that simple. What are the mechanisms? What would happen here? So an osteopath reasons from his knowledge of anatomy. He compares the work of the abnormal body with the normal body. The osteopath has his own symptomatology. Like this morning I was explaining, what was this? Well, there's a DSM-4 diagnosis, but, they had a gut-wrenching experience. That was a real diagnosis. And this one had a broken heart, So it's really, what do you really call these things? We must know the position and purpose of each bone and be thoroughly acquainted with each of its articulations. We must have a perfect image of normal articulations that we wish to adjust. So he keeps saying he wouldn't let a student touch a body until they knew anatomy. He really wants you to know anatomy. So following birth, we're going to talk about elongation and extension of all the spine. We're going to talk about how the newborn is fully expanding their chest to pull in their first breath. And we're going to discuss then birth trauma and torsion. So I'd like everybody to pair up, please. All right, so this is going to be, I'm going to work with everybody. I don't know what classes we're dealing with. This is first year, second year, third year, fourth, or postgraduate. I would like to make certain that everybody knows hand positions here. I am trying to teach a philosophy and an understanding, and you will all develop your own approaches over time. So this is not about teaching technique. This is about teaching understanding. That's my shot here. So birth trauma and torsion. We're going to learn how to examine the cervical spine. We're going to see birth. I like you to try to, in your mind's eye, imitate what it would be like to be born again. We're going to examine C3 on the right in particular, and the base of the occiput. And that's the nature of the skills lab. So I'm going to walk around here, and I want you to take a look at this and write these titles down. If you've not read these books yet, please take a look at checking them out from your library or reading them online or do whatever, because it really helps you to know who you are by knowing your history. And Still's work is pretty profound in that he just was a guy who was a man who had to create something new. And all the physical medicine modalities in America are because of this guy. A guy named Palmer was a grocer out of Middle West Iowa, Des Moines. He was in trouble with his own health, came down to Kirksville, Missouri, got an examination from a guy named Still, took care of his pain, and then he went back up to create chiropractic medicine in Des Moines, Iowa, with Palmer. So it is through osteopathy that so much of acupuncture is acceptable in this country. Massage is accepted. A lot of these things were never allowed by the MD rubrics. It was osteopaths who broke down the barriers. And anyway, so please take a look at that. So one up, one down. I'm going to walk around each of the labs here. The first goal of this is just gently examine the cervical spine. I'd like you to work on the articular pillars. And I'd also like to have volunteers of you who were, actually what I'm going to do, before we do all that, may I have a volunteer up here? I'm going to show you what I'd like each one of you to do, and then Then we'll do that. You want to come on up? Okay. Do you know everybody here?
No. I know some of them, but not everybody.
Okay. Okay. Please lay on down.
On your back.
On your back, yeah. And have you bend your knees, please. And the exam table pedals are... Yep. Sorry. Wonderful. Is this working? Is this on? No. We apologize for the technical interruption here. By the way, as you get to be an old osteopath, you start talking and mimicking people. It comes as a, wow, you see what you got to do here. All right. What I am doing is laying my hands on the articular pillars of the cervical spine here. So I'm going to start at the base of the occiput on the right-hand side, and I can already tell there's congestion right here at C1, go down to C2, and then right here at C3. That doesn't feel good at all. Yeah, pretty much, yeah. So then what I'd like you to see is that in my mind's eye, I'm seeing where things work. It's very supple on the left side of her neck, but not on the right. And we run into a catch right here at C3 on the right. So it's a place that doesn't move well. So by bringing the head into side bending and gently rolling the cervical spine toward the left here, I'm trying to counterstrain the cervical spine. And I'm just going to hold it here. I have learned that it's very important for your patients to breathe. If they can breathe deeply, nice, there we go. If they can breathe deeply in through the nose and out through the mouth, that makes a tremendous difference in how they're doing. And as she is releasing gently, I'm just simply holding this. And I'm letting the tissue expand and unwind. You feel that movement inside there? So I'm literally feeling now the tegmentum within the skull shifting. And the more powerful people breathe through their nose and out through their mouth, the more readily they are expanding and contracting their cranium. So one thing that I have seen is that when you're inhaling through your nose, you're causing flexion of the cranium, and when you're exhaling through your mouth, you're inducing extension. And the louder people are doing this, the more air they're moving, the more air they're moving, the more they're oscillating. Look at that split screen. Jonas, you're a rock star, daggone it. There we go. And a little bit of laugh is good, you know. Do you feel they can pop on the top of your head there? So literally the frontal bone just popped on the left side in relation to the parietal. So I'm not trying to get too crazy like cranial. I can feel the movement of the room right now and exhaling. And oh yeah, there went inhale. All I'm simply doing is letting the body rest. And what I'm getting here is gentle perfusion. You feel the warmth now coming into your neck? So as the capillary beds and arteries are opening, she's actually now getting warm and perfusing. I will tell you that I don't have time for this today, but I usually start all of my therapies in the pelvis first. I'll unlock the pelvis and then we go to the neck. The occiput and the sacrum are directly related through a very strong interconnected series of interdigitating vertebrae that are like the teeth of a zipper. They have to be reliant. There's no slack on the line. So you can affect significantly things upstairs from things in the pelvis. So I'm trying to show you something. I can't do everything in one session, so I'm trying to teach you a part of it. So after those releases, I'm going to feel for the base of the occiput here. And the funny thing is, as extreme as this would look, this actually feels pretty good. Is that correct?
Yes.
Yeah. So I'm bringing her back through a series of motions that her cervical spine has known from before. I try to recreate the birthing trauma in my mind's eye so that I can see how this occurred. Now you'll see people who have been born with blades. You know, they were forceps delivery babies, and they'll have torsions all over the place. But if you know what normal is, then you can help them unlock all those prior traumas through that. You're doing great. So I'm gently monitoring, feeling for releases occurring throughout the parietal bones, the base of the occiput here in my right hand. And then I start kind of changing my focus. I start doing an anatomical checklist where I'm seeing through my mind's eye how are the ethmoids doing, how the maxillary sinus is doing. Sometimes people have significant nose injuries or deviated septums. I'll get on the nasolacrimal mechanism here. And with a gentle, none of this is forceful, none of this is hurting, none of this is inducing my energies into them. There, clunk. You feel the thing just releasing there? Mm-hmm. So physically, people can get startled responses and jerks as the fascias are unlocking. I'm not going to do more than that on you today. Right. Your ears are on fire and your cheeks are really warm. So the key thing is it's about perfusion. Still, it talks about using, your hands as scalpels of blood, the scalpel of blood to heal things. And that's what this is about. I'm trying to show you how to use the scalpel of blood to restore things. The reign of the artery is supreme. Another still quote there. All right, let's partner up here and we'll give her a shot. Don't be too fast here. I don't want you to fall down. Hang on. Are you dizzy? Does anybody have a question about what we've been doing here? All right. I have a little baby who was a C-section birth, and I've been asked to take a look at the baby. So I'd like to show you how to induce a first breath in the newborn and a first breath in the baby who was not a newborn, but even if you're 38 years old, this technique still works. So what we're going to do is we're going to do mommy and baby together because babies feel better with mommies. So I'm going to work up to the front of the stage here. And I'm going to move the video camera to this end over here. Well, I can't really move it to that end over there. Yeah, I'm going to bring the stool.
Yeah, you're on the camera.
Okay. So what I'm going to do is I'm going to have mommy come over to the end of the table here. Hi, baby. So we're going to do a little interview here. Being a student doctor, I'm sure you guys are much more into this than I am. I'm a simple country internist from Chicago, so what I like to do is develop rapport with every patient. Look at that. Look at you. You're on TV. You're on TV.
Say hi.
Wave to your audience. Look at your peoples.
Hello, people.
So developing rapport with anybody is important. And many times parents will come in with a child, and I'm like, if I can't play with a child, then I won't treat the child. Like if it's not an urgent, emergent thing, I'm not going to force a relationship. I have a little girl right now who's 4 years old. She's had a seizure disorder, and she had hyperspasticity and all this stuff going on with her. She couldn't concentrate. She couldn't play with dolls. She couldn't color. Missed all of her milestones, and she was also a C-section baby. What had happened is that somehow she had a catch up underneath the frontal sinus on the left side, and she was affected her frontal lobe. So by unlocking her, she's not had any seizures now for 2 years, and she plays with dolls and she colors. She does all these things. But I spent the first time just playing with her, never really examined her. I had to really play with her and try to make sure that I had a friend before I had a patient. So.
She has asthma.
She has asthma, so this is going to be a great day for you because you're going to get a great breath. Now I'm going to bring this table down a little bit so you can keep your feet on the floor. Tell me when they're touching. Are you there, Stephanie?
Yeah.
Okay. So what we're gonna do here? Are you doing okay, honey? I'm really warm.
I say hi.
Let's see.
Take your hat and your coat. Take your coat, you can take your hat.
Yeah, I'm gonna need to bend over here. So. Thank you. Okay. So what we're going to do is have our little...
Microphone went off.
Hello? Hello?
There you go.
What we'll do is we'll have you rest on your mommy's legs. Is that okay? Okay. So I have you lay down. So baby straddle mommy.
Go.
I'm going to put pelvis to pelvis here. We're going to have mommy, baby lay on down here. Here we go. There we go. There we go. Grammy, you want to come up here, Grammy? Grammy? Oh. Yeah. There we go, Grammy, yeah.
Grandmama's coming.
Now, why don't you come on the back side here, Grammy? Come on the back side over here on the right side.
Okay.
Yep. It's,
There you go.
it's okay.
That's okay.
Grandmama's right there.
Okay.
So what we're going to do is have Grandma right here with you, and we're going to...
Okay. Yeah. Come on, it's okay, sweetie. It's okay.
Okay. So as many people who can help, that's good.
It's okay. We're gonna play. We're gonna play. Okay, and
Remember,
then
you
you're
wanted
gonna
to see.
take.
Do you
Then you're
remember you
gonna
wanted
take
to
my.
see the doctor? You kept saying yesterday, "I want to see a doctor. I want to
Yeah.
see a doctor."
And then he's gonna take my temperature too.
There we go.
Okay.
So what we're trying to do here is, if she'll let me here, we're going to try to get her to lay down on Grammy's arms.
We're gonna lay down.
Lay down.
Lay down. We're gonna play a
Should we,
game.
should we try on the table?
She's needing you to hold her.
Okay.
So let's see what we'll do. Who was another C-section baby? Any other C-section babies here in the room? Yep. Come on over here. So
Come on over.
I will have a adult C-section baby here. Yeah, then she can watch. I think that's good. I'm going to bring the foot pedal over here if I can, and then I can. All right. So what I'm going to do is have you sit down on the table.
Okay. Lay down. Or
Yeah, lay down. Yeah, and have you put your knees up here. Do we have any pillows in the room here? Any pillows?
Oh yeah.
I've got a sweater you can roll up.
That's all right. No, we'll do with what we got here. So I need your name one more time. I'm sorry.
Janani.
Janine.
Yeah.
So Janine was a section baby, and do you have any problems with your breathing?
I have asthma.
You have asthma. So a lot of people have never had a first good breath. And so what we're going to do is work on getting that first good breath in.
Remember to breathe.
Yeah. So the way we'll do this, I'm going to have you come right to the edge of the table here. I'm going to bring your shoulders right up to the edge of the table. Beautiful. And keep your head. There we go. Come on up. There we go. And sit up for me. I'm going to place my hands right there underneath your back, and then lay your head back. All right. And so my goal in this whole technique here is to introduce. We'll see what we got here. Put your arms over your head, please, and put your hands on my shoulders or however they're on my forearms. Yeah, there we go. All right. You guys able to see this here? So I'm going to have you breathe deep in through your nose and out through your mouth. And what I'm doing now, my hands are on her back. They're at T5, and I'm examining this area here. So in my mind's eye, I'm trying to get to the apex of the kyphotic curvature of the thoracic spine here. And as she's breathing, now 0 is no pain at all, and 10 is the worst pain in your life. How are we doing?
3.
Where is it hurting you?
Right where your fingers are.
Yeah, okay. So, okay. Better there?
Yeah, definitely.
Yeah, definitely better. So what's happened is that as things release, you kind of have to keep on coming down. Unfortunately, the table doesn't go up any higher, and the stool doesn't, I think, go any lower. So we're trying to make do here. A lot of osteopathy, you'll find that in your hospitals, you won't have the exam table you need, you won't have the stools you want, and you have to make do with what you have. So a nice deep breath in through the nose and out through the mouth. Beautiful. There we go. Nice deep breath so I can hear you. A freight train. Here we go. Good. And slowly, things are releasing. So this is a modification of counter strain. Do you feel it taking over now? Isn't that cool? Mm-hmm. So what happens is automatically the body starts taking over to repair itself. Deep breath. The deeper you breathe now, the more likely you'll inhale and get that right lung to expand. Many times people don't have the apical lobe of the right lung really fully functional. So this is where you like your deepest breath. So you were never really much of a long distance runner, like going out for a jog never really appealed to you, is
I
that
was
right?
a swimmer.
That's a pretty good win though for that. Were you a sprinter or were you the 500 meter person?
Endurance, yeah.
Oh, you were an endurance swimmer. Okay, good.
I did the IM.
Okay, nice deep breath.
Let me hear your exhale over here.
That's it. Now, my doula is going. There we go. No, I've been working my way up the thoracic spine, up to the inlet here. And I'm trying to get her there. There, you feel that release in the first rib? So her first rib just released on the right-hand side. Again, I'm trying to work with what I got. And I usually be much lower than she is. It'd be much lower than the chest. But all of a sudden now, it's taking over. She had so much congestion at the thoracic inlet. You feel it releasing in there? Mm-hmm. So what's really neat is that, gently, all of a sudden, you're paying a price of, gee whiz, wait, and then all of a sudden it takes off. As it takes off, it really is releasing. Yeah, we'll just, I'm kind of in the middle of things now, so that's a great offer. Now, I appreciate your offer. It's very kind. Okay, 0 is no pain at all, and 10 is the worst pain. How are we doing now?
No pain, 0.
No pain, 0. And the funny thing is, people feel this is actually, good. You feel it just releasing there. So basically, right now, you see that jump? That jump, it's an autonomic release that just occurred through her body. As you're putting things through this position, all of a sudden, spontaneously, jerks take over. In physics, they talk about energy is neither gained nor lost, it is only exchanged. So you have all these kinetic bursts of energy as people get thrown into a wall or whatever, and that gets then converted to potential energy. And you put people in a position of a still point where there's no more strain on an area, all of a sudden it just comes bounding out. So one last deep breath and we'll be finished here. Okay. All right, I lied. One more deep breath. Deepest, deep.
Let it all out.
Good. Okay, 0 is no pain at all, 10 is the worst pain. How are we doing?
0.
0. Beautiful. There it goes. Wonderful. All right, we'll come on back up. Okay. Beautiful. So by doing that with your neonates, doing that with your 70-year-olds, you can actually help them get their first breath. I have twins who are asthmatic, and one would stand like this, and the other one was like this, and they, neither one could raise their arms, and both of them had asthma, and they were just terrible birth traumas. It's taken me 3 different times to work with them, but they now stand erect. The asthma is resolved. They're off all their medications, and so these simple little things. It's about really putting people in positions where they're no longer in distress, and then waiting, and then making micro adjustments, and then leading it where it wants to go. As I said before, I usually start all my work in the pelvis. I feel there'll be an incomplete education if I don't do something to show you this, what I would do. So if I may just, is it all right with you if I just do something?
Yeah,
Okay. Well, no, I mean, I want to make sure that you feel safe and all that. Yep. Okay. So many times, the lumbar spine refers from L1, the ASIS, L3, the mid-inguinal canal, and then L5 would be the pubis, thereabouts. So based on where people are going to have pain, you can identify where the injury is going to be on their back. There's so much I would like to share, and I'm just kind of like, we'll just go with this so you guys can at least see this. So that, do you have bad periods?
Yeah.
Yeah. Which side hurts more when you ovulate?
I think the right side.
Yeah. Okay. So you can feel it right there. It doesn't feel good. She's got a lot of just soft tissue congestion right there on the right side, about where. Thank you. Where the inguinal canal is, and just like the appendix, so right in that area. So I'm going to bring her knee up into flexion, and so my hands are okay. Okay. So So breathing again in deep in through the nose and out through the mouth. So I'm using the leg as a lever and the pelvis as a fulcrum while monitoring. Look at that. Isn't that neat? So the reason I had to do this is because once you release the breathing trauma, all of a sudden I'm like, okay, let's get the rest of this done. I want to change a life. So take a deep breath in through the nose and out through the mouth. And in my mind's eye right now, I have my right hand on her ischium, monitoring the gluteus, and then my left hand is out in the front there in the inguinal canal, just above it, right in front of the ovary. And I'm literally feeling this thing guiding me to saying, this feels really good.
Yeah.
She's got a big smile on her face. Yeah. It's pretty funny. So you come up with plan A. This is not what I planned on doing, but this is what she planned on doing. What happened? What happened to you? You got twisted up pretty good somewhere.
I'm very accident prone.
Okay, there. So if people laugh, all of a sudden you feel that went away.
Yeah.
Isn't that beautiful?
Yep.
So people laugh. They get, you know, your whole goal is to get them comfortable. And a place of comfort and ease, the body will heal itself. And there's no more pain there. Yeah. Okay, we'll bring you back over.
That's good.
Yeah, it is good. So if that did not work, I would have just done this. I would have taken both legs up and over and supported her this way. I'm just trying to show you this, that anything's possible. Go with what your gut tells you to do, and just make sure that you check with the patient. And you ask, gee whiz, does this feel better? Is this a 0 out of 10, or is this better or this better? Or just make micro movements. Just figure out which way feels better for them. And they'll tell you. I'm always wanting to go the area of no pain. There are times when I engage barriers, but I make certain that I'm not causing pain. Because I'm causing pain, I'm causing splinting. My goal is to release the Golgi tendon reflex fibers. The Golgis will cause firing and stabilization, and if you cause more pain, they're not going to let the area of restricted movement relax. So you can actually induce injury by your will, not their will be done. So, guys, it's 5 o'clock. I thank you for your time. It's been wonderful to have you here, and we will look forward to future encounters. Godspeed. Good luck with everybody. You're welcome.